Hey you guys, my name is Dr. Yazdan and I am a cosmetic dentist in Newport Beach, California. Welcome to my channel. So today I'm actually gonna be a patient. So I'm gonna take you on my journey of being a patient in my own practice, and I am getting my teeth cleaned today. So I want to talk about this common misconception that you should only get your teeth cleaned twice a year. You actually need to get your teeth cleaned for most people about 3 to 4 times a year. And that's because as we age, our teeth, we have a little bit more bone loss, and then we have some gum recession, and bacteria just finds ways to hide there. And we wanna make sure we are keeping our teeth super clean, because ultimately that is going to be what is going to keep our teeth in our head. And we want to prevent decay and other dental issues, so it's really important to keep your teeth clean. I think it's one thing that it's not talked about enough. Like, people will go 1 year or 2 years or more years without getting their teeth cleaned, and they're like, oh, it's fine, I'm brushing at home. But really, like, what happens is bacteria excretes waste all over your teeth, and then that can harden on your teeth, and the only way to remove it is by getting a good cleaning. So I think it really needs to be talked about more, how important dental cleanings are and how you should stick with them regularly. It's kind of like getting a physical every year, although you want to go multiple times a year for your dental cleanings. Or, you know, it's like just keeping up with it and maintaining it is so important, and seeing your dental professionals to help you do that. So I'm going to take you on my journey today. I'm really, really excited. If you have questions, leave them below this video. I will be answering them. And also, I would love if you would subscribe to my channel and hit the bell, so every time I release a new video, you will get it. Let's go. Before I hop into my car and head to my office, I forgot to mention one thing. I want to tell you that I need my teeth cleaned every 3 months, like on the dot. And I think today will be about 4 months since I've had my teeth cleaned, and that's okay. The pandemic threw me off a little bit. And then when I went to schedule, I realized I was fully booked and I didn't want to cancel any of my patients or cancel the patients that were booked under hygiene. So it just got thrown back a little bit, but it's okay. I actually cleaned my own teeth. I brought instruments home from my office and cleaned my own teeth. But what I want to tell you is that I have to get my teeth cleaned every 3 months, because even though I have amazing hygiene, like literally I have the best hygiene. I floss, I use a water flosser, I have the best toothbrush, I have access to like really great dental care. For me, it's genetics. So my plaque builds up on my teeth because of my genetics, and it's totally fine. I just combat that by getting my teeth professionally cleaned every 3 months. So it's super important. I also want to tell you guys, like, if you guys have a wire on the back of your teeth, a lot of people have permanent retainers, and I have one myself. That is somewhere that plaque builds up quite a bit. So I myself get a lot of buildup there, but I actually combat that using a water flosser has really helped me. And then I get into my office every now and then, every like month and a half or 6 or 8 weeks or so, and I'll like clean that area myself. But those of you that don't have access to dental tools and don't know how to use dental tools, please don't buy dental tools at like the grocery store and use them on yourself. That's very dangerous. But those of you that don't know how to use them, just make sure that you're visiting your hygienist and using the tools they recommend, the floss, the water flosser, the toothbrushes, and all of those things, and the toothpaste. So I'm excited to take you on my journey. I just want to tell you guys that, yeah, a lot of people, like, their genetic makeup creates more plaque buildup for them. And so you have to be really aware of that and combat that, because I don't want problems later down the line. Actually, I just texted my periodontist, which is a gum and bone specialist, that I had a nightmare last night, that even though I have like spectacular hygiene, that he was like telling me that I have so much plaque buildup, and he was showing it to me. I was like, why am I having dreams of this? But anyways, that's besides the point. All right, I'm gonna pack up my car and we're gonna get on my way we're gonna go to my office and see how it goes. So I just packed up my car. I have little Napoleon back there and a lot of my daughter's toys. My daughter has so many toys, and that's how I keep her entertained in the car. She's not in the car right now, but I keep the toys back there. And then of course, Napoleon, sometimes he comes to work with me. Napoleon, say hi. No, he doesn't want to say hi. Anyways, the great thing is I actually live really close to my office. So my appointment is like in 10 minutes, and I'm gonna be able to make it on time. So let's go. So I just got to my office. My hygienist is ready for me.
Yeah. Okay. I don't know what to say. Okay.
What you're doing?
Actually, I am scaling your teeth with a universal scaler. And I am on my first pass through. Dr. Yazdan has good hygiene. She has a few areas that are slightly inflamed. And that's why we bring her in every 3 months, because her genetics have it where her tissues are more easily inflamed, even with small amounts of plaque. So I'm going through and doing interproximal and subgingival scaling and surface scaling, and seeing how her tissues are responding to me. You do know these are your front teeth, and then
That's my follower area.
Back here.
That area. On your side. They're detailed. Okay, so Jill just finished my cleaning, and since we're not allowed to polish because of COVID spreads less aerosol, she's gonna do her own special COVID polishing.
I can only go so far back.
Yeah, you want to talk about prophy paste? You know what it does?
The prophy paste, some of it's fluoridated, some of it is not. We carry both varieties. And it is somewhat abrasive, so you want to be careful with it. You don't want to really just buff it into the tooth. You want to be gentle with what you're doing, but it does give a nice finish to the tooth, and we are just very careful with it. And our patients do like, open a little bit, do like to be polished, so we do try to accommodate as well as we can with COVID measures in place.
So now she's about to floss my teeth after she's cleaned them and polished them. Whoa. And flossing is super important and super underrated, but you only have to, it's true, you only have to floss the teeth you want to keep, right?
Right.
Yeah. Go ahead. So one thing that Jill always does is she flosses the back of my last tooth. So a lot of people think that you just have to floss between the teeth, but it's a trick to floss the last tooth as well on every side, because there's lots of presents hiding under there, so make sure to keep those clean.